We have Dora here, the Explorer. So she came in because she has something going on with her skin. And Dora, can I see your back legs, mommy? Can you see your back legs? And your tail? So if you can appreciate how chunky her tail is, it's not normal. It feels very squishy. And her back leg also.
The one that's right there.
The one under here. Yeah, this little fat one here. She also has a lot of hair loss, and you see how wrinkly her skin looks, even around her lips and around her eyes
and her neck
and her ears, essentially everywhere. Hey, sweet girl. So, I mean, there are a few things that could cause a puppy's skin to look like this. One of them, or the main one, would be something like mange, which we have checked her for this morning, and she is mange negative, so we can rule that out. She's not contagious. The second thing is bacteria living very deep in her skin, which unfortunately she does have, right? So she will, of course. This cat. Hi, Mooney.
like, wait.
Oh my God, Mooney.
Dora's face. What the heck?
What is that?
Sorry. Mooney, you're interrupting an interview.
He said, I'm the star of the show.
Obviously.
Always.
So.
Sorry.
Everyone
So,
knows
yeah,
that.
Serious now, yes.
So, I mean, I suspect strongly that that's what she has going on. She does have a deep skin infection, which means she will need some antibiotics for a couple of weeks. I'm going to give her something to help relieve her itching also. And she will need to get some antibiotic or antiseptic shampoo added on to help kill this bacteria. I'm hoping that as she progresses with her antibiotics, that we'll start to see some improvement with the legs, because I believe it's just the infection that's so deep under her skin that's causing
toes are all
all
swollen.
the swollen toes, the sausages. All the sausages. Right? So
And Doc, what if this was left untreated? What would you think would happen? The reason I say that is because, remember, we picked Dora up off the street, and I know that there are other dogs I see on the street that look very similar, again, with like the swollen feet and stuff like this. So what do you think that, obviously we need to spay and neuter and stop it happening, but this is something that needs veterinary attention.
Oh, definitely, because not just is she very uncomfortable, it does make her quite itchy. The more she scratches, the more she'll break her skin, the more she's prone to getting other things like yeast. And these infections can get quite deep. I mean, as far as we're seeing, it's quite deep in her feet itself. So if this was left untreated, I'm sure she'll start to get all these like bumps with pus all over her body. Eventually, she could even get maggots.
Yes, because the fly would come.
Because the flies would come. Flies love things that are moist and warm, and lots of nutrition and nutrients there. So definitely. And eventually, that would be maggots would have been probably the end of her.
Yeah.
So a long and miserable time.
Definitely.
All right, Doc. So we're going to be coming. When do we need to come back to see
I
you?
would like to see her in about 2 weeks. So that's the first progress check. And about every 2 weeks from there. So obviously we'll be extending her antibiotics even after her skin looks 100% better. She'll still need to get antibiotics for a couple of weeks.
Okay, so we got a long way before Dora's going to be ready for a home.
Just a little bit. Can I see? Can I borrow it?
No. Thank you, Doc. This is Dr. Brown at Noah's Ark.